All right, how's it going? Pura vida from Costa Rica. This is Dr. Jeff talking about overcoming anxiety and depression. So, guess how many guests that we have check in every week? They report having anxiety and depression, almost 100%. So, I want to clarify what this really means, how you can work through this here at Rythmia, and how you can push through some of the emotional challenges you guys are facing in your life. Now, as a psychologist, I have experience working with people that have clinical depression and clinical anxiety. These situations are debilitating and they prevent you from being successful in your life. So a lot of us have a normal range of emotion. A lot of us have depressive moments, anxiety moments, but we don't have diagnostically anxiety or depression. So it's important to understand the difference between the two, because what happens is if things aren't going well in life, we go see a psychologist, we go see a psychiatrist, and what happens is they prescribe medication. So a psychiatrist, there's a lot of good psychiatrists out there. There's a lot of really shitty psychiatrists. Okay, so psychiatrists, their sort of protocol for what they do as doctors, okay, is they prescribe medication. And this medication is very, very, very helpful to some people. However, it is not needed for most. Okay, so I want to explain what the difference is between if you need it or you don't. Okay, so all of us have choices in life. All of us have decisions to make. All of us have life circumstances. Some of us make bad choices, right? Like I used to make a lot of bad choices, but now I try my best to not do that. And so when I was making a lot of bad choices, I was bummed out. I felt crappy. I didn't like the results. I was depressed. I had anxiety. And I thought, oh, well, I must be depressed, right? No, I was just making bad choices. Okay, I was like in a way of thinking that wasn't conducive to my success and me thriving as an individual. So if a psychiatrist met with me and I said, yeah, you know what, like I feel down, I feel like I don't have any lust for life, I don't enjoy my job, I have poor relationships, the psychiatrist would say, okay, good. Okay, so we'll work on that, right? But I'm going to give you some SSRIs, give you some antidepressants, and maybe I'll give you an anti-anxiety med too. Depends on how you're doing. And I'm going to give you some medication. Then you need to go see a psychologist, okay? Go see a psychologist and talk to that person about what's going on. So I was that person. I was that person that was a psychologist that had all these patients coming to me that had just been given a bunch of meds. And I would say, okay, so you claim you're depressed. Okay, you're on antidepressant medication. You have an anti-anxiety pill like a benzodiazepine, Xanax, an Ativan, a Klonopin, you name it, Valium, whatever. And you say that you're depressed. Okay, so what's going on? Well, I don't get along well with my family. I don't like the job I'm in. My relationship sucks. Okay, so let's make some behavioral changes. Let's make a shift in what you're doing behaviorally. Because I'll tell you what, the beauty of working in a locked psychiatric unit for several years was that I really got to see what depression looks like. I got to see what it looks like clinically. Clinical depression is not some sort of thing where I just don't like my life. Clinical depression, the patients I worked with were crying nonstop. They barely got out of bed. They didn't take a shower. They had poor hygiene. They had substance abuse issues. They had no family or friend support. They had burned all their bridges, okay? Those people were what's called clinically depressed, okay? So that is sort of rare, right? Because that has to do with serotonin, has to do with dopamine, has to do with norepinephrine. There's a lot of neurochemistry going on, okay? I had a woman that I worked with for many years that was like super successful her whole life. Then something clicked in her brain and she had this hardcore dopamine issue. And she was super depressed. She couldn't even get out of her bed. She could not even function. She made poor decisions after that too. So the beauty of what's going on at Rythmia, okay, the beauty of what we're doing here at Rythmia is we're looking at the neurochemical side of your anxiety or depression. But I want to make something really clear. The decisions you make, right, and the life circumstances that you are dealing with and the things that are imposed upon you, and if you're in an abusive relationship, that contributes to this, right? Those things are affecting your mood. That may not be depression, okay? Depression is something that's like neurochemical based. So the beauty of plant medicine is that we get to resolve this neurochemical issue. The plant medicine we use balances your neurochemistry. It brings the dopamine receptors back into play. It works on 5 of the serotonin receptors in your neurochemistry. The synaptic cleft is in your brain. It's the neurons. They don't touch each other, but they communicate by having neurotransmitters flow in between. Serotonin is super important in that. So is dopamine. And there's about 18 others that are very important. The imbalance of those things is causing your mood. However, your decisions are causing your mood, right? So there's 2 sort of ways I describe anxiety and depression. One of them, like I just said, is neurochemical based. There's some people that have that. The other one is behavioral based. Poor decisions, life circumstances, like bad relationships, not having the tools to deal, right? That's kind of like what that is. So like, for example, a silly example, and forgive me for giving this example, people that are overweight, there's that thyroid issue, then there's I just eat like crap issue, right? I'm not some skinny dude, okay? So I'm not tripping on people that are overweight, okay? But most people don't have a thyroid issue. Most people have a poor food choice issue, lack of exercise issue, right? That's the reality of obesity in the U.S. and in other parts of the world. Okay, so just like depression and anxiety, some people have a neurochemical issue, but most people have a behavioral issue. Okay, so let's get to the bottom of that. Let's give you the confidence you need to make a shift. Let's get you plugged into who you are as a person. Let's get you here. You can see what you've become. You can see like all these things you've created for your life, some great, some not so great. Let's have you plug into yourself and resolve those things, right? The way to overcome anxiety and depression is to plug into yourself as a person and see who you really are and what you've become and reunite with who your soul is, right? You can get a new heart. That's the way to do it. It's the only way. Or if you want to, you can go see your psychiatrist. They usually see people once every 3 months. Okay, so you can see your psychiatrist 4 times a year. He or she can give you a bunch of meds. You can go see a psychologist that just asks you every time you're there, says, how do you feel about that situation? How do you feel about your mom saying that to you? How do you feel? Well, you know what? Let's get a robot to be a psychologist in that case, right? I can program a robot to ask you those questions, okay? You don't need to pay $250 an hour to go do that nonsense. Okay, it's freaking nonsense. Get to who you are as a person. Get grounded and get focused. That's the goal. Overcoming anxiety and depression is a big part of being successful in life. And the way you can do that is by coming to Rythmia and getting what you need with yourself. You are the best teacher for you. You know what's best for you. Every single week, I meet with people here. I do sessions throughout the day. I counsel people, talk to people, right? And what it all comes down to at the end of the day is they had some historical trauma and they're trying to work out their life right now, and they feel amazing because they're plugged into themselves doing our plant medicine, the other modalities we offer, and they're a little confused, like how does this is like a new frontier. I'm actually in charge of my own emotional situation. Well, guess what? That's the case. You are in charge. Society wants you to think that you're not. Society wants you to think that you need these experts to tell you how to feel. You need these multi-level doctorate people and doctors and therapists and all these people. You need them to tell you how to like focus and feel and be productive in your life. You know what I say about that, right? I read, maybe some more books than most people. I read a lot of psychology books. I worked with some people. I took I took 18 years of school. Does that make me an expert in like how you're feeling? Guess what? It doesn't. It doesn't, because you have your own circumstances that are unique to you. That's what makes you an individual. It's an amazing thing. It's beautiful. So don't be brainwashed by the system. Shift that. Get that out of you. the rhetoric, the talk, and all the words you've heard from people, from psychologists and psychiatrists and doctors, you know what? Throw it out the window. You can heal yourself. You can do it. Come to Rythmia. We'll help you do it. We provide this safe space for you to do it. We all I do all day is try to figure out who's needing the support right now, right? That's all we do. We have a group of staff that are looking to help. Who needs the support? Who needs it? And we're providing counseling and guidance and support for this whole process. You can do it. You're the answer, not these external people who think they're so freaking smart. I don't give a crap how smart somebody freaking is. It has nothing to do with me, okay? What has to do with me is my own life, my own decisions. And I'm going to make those decisions because I'm entitled to, because I'm an individual, and I'm going to do what is right for me. And if I'm blinded by trauma, if I'm blinded by a history of adversity, if I'm blinded by some cognitive distortions and I'm not thinking right about stuff, okay, cool. That's life. I'm going to get clear and block that stuff and get it out of my life. I'm going to come to Rythmia and see who I've become and see who I really am, okay? That's how you do it. That is how you overcome anxiety and depression. Pura vida, power to the people. Come to Rythmia. We'll see you guys soon. Thanks, you guys. Dr. Jeff, Chief Medical Officer, Rythmia Life Advancement Center. See you guys soon.